and welcome to the program. I am Amarachi Ubani. Ebola is still a scare for many West African countries. Unfortunately, we're dealing with a disease more deadly than the AIDS virus. So understand the expediency with which scientists across the world are trying to discover a solution, a pill, a capsule, anything that could be described as a cure for the disease. But there's one sure way of curbing the virus, and that's not getting infected at all. Doctors have emphasized the need for greater caution paid to cleanliness, both personal hygiene and surroundings, and the non-consumption of certain meats that may be harboring the virus. Last week, we talked about measures countries around the world are adopting to identify and contain the spread of the disease. Now, apart from screening at the airports, countries are now adopting a non-entry policy for countries with recorded cases of the Ebola virus.
The World Health Organization has said it's quite unnecessary for countries to shut their borders against neighboring countries to curb the spread of Ebola, saying that such measures could heighten food and supply shortages. Had Nigeria shut her borders against her western neighbors, the Liberian-American Patrick Sawyer may not have presented as the country's first case. But for countries like South Africa, the action comes with exceptions. It's for non-citizens. So will citizens living outside the country face the same fate? Not quite. Although the ban applies to travelers from high-risk countries, that is, Guinea, Liberia and Sierra Leone, any South African returning from these countries will be subject to a strict screening process. They will need to complete a comprehensive health questionnaire before being allowed entry back into the country.
South Africa takes stringent measures because all of us depend on you because of your facilities. For South Africans who want to travel to those countries, we will discourage them and requested them if they could delay their travel unless they can prove to us that is absolutely essential.
Senegal has also announced a travel ban on citizens coming from countries affected by Ebola. The Health Ministry has defended the decision, saying that right now, the country is focused on prevention of the deadly disease. Like Sierra Leone and Liberia, where the new cases are rising fastest, Senegal has a low ration of doctors to its population, with just one for more than 17,000 people. But its decision is already affecting UN flights carrying aid. The UN had plans to operate regional flights from Senegal to other parts of West Africa, where more than 1,350 people have died from the Ebola virus disease. Chad has also announced closing its borders with Nigeria to protect the public's health needs. Cameroon is also reported to have closed its borders with Nigeria for fear of the virus getting in. Côte d'Ivoire has closed all its borders with countries most affected by Ebola. While air travel seems the most affected when it comes to movement of people, countries such as Ethiopia are continuing flights to Nigeria, but everyone coming from West Africa will be checked at a special quarantine center. The WHO has said West Africa could continue battling with the Ebola virus disease for the next 6 months. But it's a race against time to save as many people as possible and prevent any new outbreaks. As for the use of experimental drugs, they are what they are, experimental, and have not been proven to cure yet. So, the real solution here is prevention. But with African countries slamming the doors on one another, countries may be dealing with bigger losses in the end.
International experts say the shutting of borders against countries such as Nigeria has grave consequences which could hinder the resumption of normal relations between them. Professor Bolaji Akiyemi has just finished his assignment at the National Conference in Abuja, but he expressed his thoughts on the issue in this phone conversation.
I think it is an indictment of their own so-called neighborliness and friendship with Nigeria. First of all, it's a futile act. Those borders are so long an act of hostility which is so unnecessary. And I think that Nigeria should simply draw the red line to that kind of anti-friendly neighborliness from our so-called neighbors. I think any country that closes its border against Nigeria resulting from this Ebola crisis should feel the negative repercussions of such an action. I think Nigeria should declare that a hostile act and declare those countries hostile countries, which then really means that they will not benefit from anything at all from Nigeria when this Ebola crisis blows over.
Will that include the countries that are refusing to give Nigerians visas to come to their countries?
Well, yes, of course they're going to do that. And there's nothing we can do about it. But we can hurt them in so many other ways. These are countries that benefit from Nigeria one way or the other. If you are going to be hostile towards us, we'll be hostile towards you. When this whole thing is over, then what you're going to do is to refuse to allow their own citizens to come into Nigeria, stop attending meetings there, and stop them from attending meetings in Nigeria. And just make sure that life is difficult. Not for their citizens here, because their citizens here are not to blame. But there are several other, avenues. There are several other theaters in the world where we meet, whether it's at the United Nations or at ECOWAS or wherever it is. So many places. And you will simply react that way. Support their own resolutions. You won't support anything that they want, nothing.
Professor, there are countries in the West who are advising their nationals about coming to countries that have cases of Ebola: Nigeria, Liberia, Sierra Leone, and Guinea. What do you make of the travel advisory? It is advisable anyway to be careful where you're going, but should it really be discouraging people from going to these countries?
No, I don't blame any country that is asking its citizens not to come to Nigeria at this time. Everybody is frightened about this Ebola menace. It's unfortunate it didn't start in Nigeria. It was brought into Nigeria by an American. Let us get that clear. It is okay for everybody to say that guy was a Liberian. He was also an American citizen. If that man had won a gold medal at Olympics, they'd be calling him an American. But now they forget that he's also an American citizen. But I don't blame any country that tells its citizens not to come here. Even though we have money to continue it, we have recorded more successes than any country in dealing with this without using drugs. But I am not going to blame any country that says its citizens should not come to Nigeria. They're just doing what they are paid to do, which is look after their citizens.
And you can join in the conversation. Just go to our page on facebook.com/diplomatic channel. Tell us what you make of countries shutting their borders and countries where the Ebola virus has been recorded. In the meantime, coming up after the break, an ideology. That's what Professor Edwin Smith of the University of Southern California says. The IS militants in Iraq, Al-Qaeda in the Maghreb, and Boko Haram in Nigeria have going for them in their quest to take over the world.